Now, for those of you who don't know me, my name is Swati. I'm an executive mom power coach. So basically, I help moms who work as executives manage the physical challenges that come with motherhood. Now, this could be anything from a simple neck pain to back pain, a poor posture, or a weak pelvic floor, and really anything in between these. So, as we were saying, let's talk about three kinds of back pain, three types of back pain, and what can you do about them. So I met somebody recently who went to the doctor with some back pain, and they found that, like many other people, so the doctor told them they have acute back pain. Now, this person came back to me and they said, what exactly is an acute back pain? So it's just a simple terminology that is used in the medical world. There are three terminologies that I'm going to talk about: acute, subacute, and chronic. So sometimes the doctors will throw this medical jargon at you and you do not quite understand because they are so in that world that they don't probably have the time, or they don't realize that they need to explain it to their patients. But I will just talk about those briefly here. So, if any medical professional tells you you have an acute back pain, what that means is your back pain has either just started or it has been there for about 4 weeks. So anything from 0 days to 4 weeks is classified as an acute back pain. Now, when I talk about these time frames, our body doesn't work with time frames, but this is roughly the time that your acute back pain will be present. So, what happens is, in this you will probably have some sort of activity, or for example, you've bent forwards, you lifted a heavy weight, you've had this sharp shooting pain right after a cough or a loud sneeze. Yes, that's possible. People do have disc issues with loud sneeze and cough. So you've had these, basically there is one thing, one episode that has happened and it has led to your back pain. So you can easily identify most of the times why you have the back pain. Now, the second kind type of pain is a subacute pain. So this is basically anything from roughly 4 to 12 weeks. Now, subacute means basically it's not something that's just happened, of course, because it's like 4 weeks old. It's not something that's just happened, but you might have some activities that aggravate your pain and some activities that relieve your pain. And I'm just looking at my notes here, so that's why I'm looking away from the screen. So for example, you might have a on and off pain, like a sciatica pain, like a dull achy pain in the background. It might go down to zero, it might not go down to zero, it might be always there in the background depending on what the issue is that is causing your back pain. Now, there is no certain activity that has happened between that 4 and 12 weeks. Okay, now if somebody tells you that you have a chronic back pain, usually in medical terms, they are referring to a back pain that has been present for over 12 weeks. So basically, same as subacute, you might have aggravating and relieving factors for your back pain. So something like, whenever I bend forwards to a certain extent, my back pain flares up, or when I bend backwards, I feel better, or when I'm walking, I feel better. So you'll have certain activities that will make your pain worse and certain activities that will relieve your pain. So, what can you actually do? So, when you are in the acute phase, especially when you have just had the injury, or if you have any sharp shooting pains, or you have any, like pains that are radiating, say, pain that is present in your back, but it's radiating down into your legs or in your neck. We're talking back pain here, but basically it's radiating to any other part of the body. You want to firstly rest that part. You obviously want to go to the doctor, get some medication for it. If it's really severe back pain, you can wear a lumbar belt or a corset, as it is called, to support the area. If you don't have one of those, take a broad scarf and then tie it around your lower back in the area of pain, firm enough to give you a pressure but not tight enough to block out your respiration, so it's not uncomfortable but it's firm enough to give you like a pressure in the area, as if somebody's holding you like a belt. So that is something you can do if you have an acute back pain. Another thing you can do is a cold pack. cold always eases the inflammation. In the acute back pain stage, you will most probably have a lot of inflammation in the area. So cold pack on the painful part will be helpful. Now, usually people get confused between hot packs and cold packs. I have done some YouTube videos. If you go to my YouTube channel, you will see the videos on hot packs and cold packs, so you can have a look at the details there. But in general, hot packs will help with muscle spasms. So suppose you wake up in the morning and you've had this really stiff back, a hot pack will help with that. Now, this would probably be more prominent in your subacute and chronic stage. So don't worry about it if you don't remember the stages and the types of back pain. Just remember, cold is when you feel a dull, achy pain, when you have inflammation in the area. And a hot pack is when you feel that your muscle is in spasm, you feel really stiff. An example would be if you get in the hot shower, feel really good about your back, then probably a hot pack will suit you better. Anyway, go to the YouTube channel and have a look at the details there. And obviously, if you like the video, you can always like and subscribe to my channel. Another thing is, I talked about aggravating and relieving activities. So those activities that make your pain go up or make your pain, go up in intensity, please avoid those activities. For example, instead of bending forwards, go down, kneel down on your knees, or squat down, or just ask somebody else to help you pick up whatever you bending down for, or to tie your shoelaces. Or better still, just wear slip-in shoes till you have that acute pain. So avoid the aggravating activities, and of course any activities that make you feel better, go for those. Now, this could be something as simple as that hot or cold pack that I spoke about, or it could just be simply lying in bed in a certain position. You stick to those activities that relieve your pain so that your back has enough time to heal itself. And of course, go to the doctor, get your medication. He might further refer you for an x-ray or MRI. You can discuss that with your doctor. Again, I have a YouTube video of on those x-rays and MRIs and back pain. There is a time and place for medication, especially in the acute phase, or if you keep getting those strong nerve pains like sciatica, or any other nerve pains or radiating pains from the lower back to the legs or the feet. Definitely go and visit your doctor, take the medication. I'm not one of those who'll pop in a Panadol at every little ache and pain, but yes, there's a time and place for medication. So do not ignore that part of it. If you have back pain, go to your doctor, get your medication, discuss with them as to how and when you want to take the medication. The details of that are beyond the scope of this video, so I'm not going to discuss that. All right, so these were the three types of back pain: the acute, subacute, and chronic. And roughly, this is what you can do for them. And yeah, I hope that was useful, because sometimes this medical jargon just comes at us and we don't know what exactly the doctor means. And it can be a bit overwhelming when you've had a diagnosis, especially if it's the first time you've been diagnosed with back pain. Alrighty, I hope that was useful, and I'll see you guys next time. Bye for now.